Hello, hello. Welcome to Family Vlogs, and I'm live. We want to start the discussion. I know nimefika mapema. It's 1 minute to time. It's 1 minute to time. Let me tell members I'm live. Let me just tell members I'm live. Yes. Live. Yes, now I'm waiting for people. Welcome to Family Vlogs, and today is a very good day, and we thank God. And we want to discuss a very nice topic here, the one pinned about let me adjust this. Yes, rabies, that is dog bites, snake bites, bee stings, human bites, and we're also going to check hornet and wasps. Yes, I know, guys, you've been waiting for this, and this is the best time to discuss. I'm very happy to tell you that um, this is a live discussion that I want people to participate and to help in these two tropical neglected diseases like rabies and snake bites. I want you to join me as we are going to discuss very many issues. Yes, somebody has joined. Welcome so much, and uh, yes, Monica, hello. Yes, I've just pinned you. Hello, hello. Thank you so much for joining. And that's the topic that we are going to discuss today. I thank you very much, and be with me till the end of this live broadcast. I thank you so much for joining me. I'm very fine, Monica. I'm very fine. Mungu ni mwema. Tuko strike sahi, tuko kwa nyumba. Tunataka haki zetu. So I want you people to assist me in discussion of today. Somebody has also joined us, and I thank God for today. You can also join through StreamYard. The link is below there. I've just posted the link via StreamYard. It can bring you to the screen, and maybe we can discuss. If you have StreamYard, just log in and enter. That is it. I've posted it there. So you may log in. You are really afraid of snake. In fact, black mamba is here. There are very many species of snake in Kenya, and they are very poisonous. So I'm waiting for a quorum so that we can go ahead. But I know if you are joining me today, and if you are joining this video or after this, do subscribe and share my videos. And I'm happy that we are doing this today in terms of discussion. Now, I've channeled this discussion to dog bites, snake bites, bee sting, human bites, wasps, and hornets. and any other questions that might arise, we can put in parking lot. I don't know. Are you people getting me well? Am I audible or I'm mute? I hope my camera is okay, and lighting system I think is a bit night, but I think we are doing well. So let's do it now. The purpose of doing this video is just to inform my members that we are okay. Let me see whether this volume is working well or it's not working. I don't know whether you people are getting me. Let me test it this side with PC. Okay. Okay. I can hear. Okay. That's good. So no need of testing. I thought it was not audible. You can hear me, and okay, you can join via StreamYard when you like, and we can go ahead with the discussion. Now, I would like to start with a discussion about rabies. And if I mention rabies, you think of dogs. Dogs. Mostly people think of only stray dogs, wale wanaozurura zurura ndio wako na virus ya rabies. No, if we talk of rabies, it can even, in fact, 99% of rabies is being diagnosed from domestic dogs. Domestic dogs are dogs that we keep. They have rabies. Okay, I hear you well. Just share it. You are still in the office. Yeah, it's good to work. It's good to work, and that's bring food to the table. Rabies is a viral zoonotic disease that affects the brain of the animal that has been attacked or infected, or even human beings. If I say zoonotic, it means it is a transmission from one animal to human being. That is zoonotics. It's a viral zoonotic, and it's normally affecting the brain and causes inflammation. Normal layman nafura kiasi. Yes, and this normally affects an individual who have been bitten by a stray dog, or even cats are also there, even domestic animals, the one we keep, the livestock, the one we keep for meat, wool, milk, they normally develop rabies if they have been attacked by dogs that are infected with rabies. Others like coyotes, skunk, fox, mongoose. Mostly we do not have them in Kenya. I don't know whether we have wolves or raccoons in Kenya. They are also posing a great risk. In fact, they normally attack cows like wolves attack sheep. If the sheep survives and it has rabies, then this one can pose great danger to us as human beings. Now, I've said that. How can you contact this rabies? From the saliva, from the scratch. I've mentioned bite. So when a dog who is infected with rabies licks an open wound or a breakage in the skin, it can cause somebody to suffer from rabies, even scratches. This virus normally attacks the nerves the brain to the spinal cord. And as you can see, uh, let me invite some people here. Okay, let me invite them. Maybe they do not know. Okay. Hello guys, I've started live vlogging. Kindly join me via the links that I've provided. Oh, yeah. Live. Kindly join me so that can join me via this one. You can join me via YouTube channel straight away. Yes. This Wi-Fi is buffering, but I hope you can still get me. The Wi-Fi is buffering, but I hope you can still get me. Okay, I'm still live, and I want you people to join the discussion. So we have said that it's a viral infection that causes inflammation of the brain in humans and mammals, and can be prevented by vaccination So that is the definition. And I've said that when a dog bites you, scratch you, or licks an open wound or any breakage in the skin resulting into the rabies virus affecting you. Now, let's continue. I've mentioned also other ways, other animals that can pose great risk to human beings, majorly in Kenya. I've mentioned livestock, our domesticated cats. Cats can also get rabies. Other countries, like I've mentioned, bats, coyotes, wolves, mongoose, raccoons, and skunk. Some of them are not here in Kenya. Now, let's continue. Incubation period of this rabies is 2 to 3 months, and it can go up to 1 year. And in treatment, even if you are bitten by a dog and you come months later, World Health Organization recommends that we treat you as a new patient. We treat that rabies as a recent infection. So I don't know whether you people are getting me well, or the network is buffering. I don't know whether it's going on. So let's continue. Now, signs and symptoms of rabies. We classify into 2 stages: stage 1 and stage 2. Yeah. When you have been attacked by a dog or unprovoked dog, there are 2 different cases in this scenario. There's a dog that has been provoked. That dog has high risk of being rabid than a dog that has simply attacked you. So when you are bitten, there are some signs and symptoms that will manifest earlier in 10 days, like slight headache, fever, general body tiredness, nausea, and vomiting. That one we classify them as stage 1. In stage 1 also, you will be experiencing pain. Oh, welcome. Welcome, welcome my friend Kenya Sihami. Subscribe in this channel. Brand, boom. Nimesija. Umekwisha ingia. Tumekukaribisha sana. Kenya Sihami. It's a good channel with very good reviews of Maria Citizen TV. Welcome to the channel and welcome to the discussion. We have defined rabies. We have said it's a zoonotic viral disease causing inflammation of the brain of human being or an animal. If I say zoonotic, it's from an animal to human beings, to man. And then we have also mentioned some, okay, I'm seeing something here. Okay, that one umesalimiwa. Umesalimiwa na Monique. I hope umepata salamu. Ama hujapata salamu, ni pin hiyo salamu. Hiyo ndio salamu. Nasikia tu snake na mimi hatupatani. Brayo, anyway, we will also reach there. We laugh, we discuss. It's a class. We don't want to sleep. So teachers might also crack jokes. Network sometimes is buffering. I'm using a 4G internet with good bundles. I don't know why it is spinning. I'm looking at my PC. I'm seeing it's spinning. I don't know whether you people are getting me well or okay. Karibu sana kwa channel. Brayo, okay. Brayo, kindly tell guys in the group to come and join me, the two groups, so that the discussion can move on well. Now, we were talking about stages of rabies. We have stage 1 and stage 2. So stage 1 is a vague stage. In fact, you can't know. With a history of dog bite is what you can conclude that this is probable rabies, because they present even like malaria, typhoid, pneumonia, except there is no cough in stage 1. Like somebody will have headache, fever, tiredness, loss of appetite, and the only thing that will now differentiate is that a patient will tell you, I have pain. There's a site that I have pain, mostly where the dog has bitten, whether the buttocks, maybe, or the thighs, or the lower limbs. Sequembe, the gastrocnemius muscles, they normally like biting that place. So stage 1, you can never know. Yes, Kenya Sihami, there's a very thing here. Let me put it so that you can see. Monique is saying a very important thing as we were discussing stage 1. Okay, now let's go back. So that one, I've sent the message home, Monique. I've sent the message home. Tell guys, I'm alive. I'm live. Yes. Okay. So whatever, let me see. Hiyo ni B ndio naweza ongelea cause kuna siku what? Let me read this thing well. Kuna siku what happened? Hiyo ya B ndio naweza ongelea cause kuna siku mzinga yote iliniangukia nyuki, iliniuma umeume. Nilioshwa na mafuta na nilitapika white substance for 1 hour, almost died. Hi. Wow. Kenya Sihami, That's unfortunate. Of course, we'll discuss about bee sting almost towards the end. But kindly tell guys in the group that we have started. It's 8:19. Some are 19 minutes late. Just tell them I'm live. Asumbi TV, nimemiss Accord TV, Mary Queen. Tell them that we are continuing with the discussion. Kenya Sihami has confirmed that Monique, tumesha connect na Kenya Sihami. Now, we have discussed stage 1 of rabies, and we've said that you can never tell if one has a stage 1 of rabies except if there's history of bite, kama mbwa ilikuwa imemuuma. Yes, because it presents like I've said, malaria and typhoid fever and acute pneumonic presentation. Now, stage 2 is where I want you to pay keen interest and keen attention on stage 2 of the virus rabies. Now, in this stage 2, several things will be happening in terms of clinical presentation. And remember, I will also inform you how to know whether this dog is ready. The signs and symptoms in men or human being is more or less the same as those who are those of dogs. Yes. Okay. Monica's responded. Tell more guys to come. Tell more guys to come that I'm live and the discussion is going on. I don't know why this network is buffering. Saa zingine inazunguka. This story of Nani is so nice. Let me pin it there. It's so nice. Yeah, Boomlet. Oh, it's big. Eh? Oh, okay. Aye. No. Yeah, me. That one Nani has responded. Now, look at Kenya Sihami. I love what happened, but it's unfortunate. I don't know, hiyo ni mafuta gani ulipakwa nayo? Hiyo ni mafuta gani ulipakwa nayo? Okay, let's continue. It's a nice one. It's a funny experience, but it's so sad. It's so sad. Okay, thank you. Thanks a lot. You call them. I hope they will respond. Now, let's continue with the discussion. Oh, my guy. My guy, Asubi TV. Umeona kitu yenye ilifanyikia Kenya Sihami. Let me post it again. Okay. Hiyo ya B ndio naweza ongelea cause kuna siku mzinga yote iliniangukia nyuki iliniuma umeume. Hiyo ni tamathali za usemi ama hizo ni nini? Nilioshwa na mafuta na nilitapika white substance for 1 hour. Okay, I love that. So, welcome Asumbi TV, and I'm very happy you joined us. Asumbi TV is a nice channel that has some good teaching and low comedy. Kindly subscribe to the channel and for you to enjoy the teachings that are being offered by Asumbi TV. Now, we have defined rabies. We have mentioned how you can contact rabies. Also, we've talked about signs and symptoms, and we were in stage 1, which we say is vague. You can never know, presenting even like malaria, except there is a bite and there is nibbling or tingling sensation at the site where the bite has taken place. Now, We are in stage 2. Stage 2 is where now the rabies, the virus has attacked the brain. In fact, in stage 2 hakuna kurudi. Hata kama kutibu, management is normally supportive. No much can be done. They will present with one, photophobia, fear of light. Sahii wakiona tu light, they develop spasm. Even little noise, they have photophobia. They fear light. And then they develop what we call hydrophobia. Hydrophobia is fear of what? Merge, water. Yes, they have hydrophobia, they fear water. This is now when, oh, naumbwa naye. I used to be working na Kenya Power. Kuna siku mtu alinifungua gate, akafungua umbwa juu, nimekata stima. Boy, hey, uliona maajabu. Let us read it very well. Let us read it very well. Hey, pole sana ndugu yangu. Pole sana ndugu yangu, uliona maajabu. Hai. Sasa hiyo ndio ilikufanyikia, ha? Nilipanda mti mbio, nika call kwa ofisi mpaka walikuja na polisi ndio wakashuka. Ayo, pole my guy. Pole sana. Pole sana. Let's go back to our discussion. Okay, we are live. We don't talk much. Fear of light, fear of water, and then they develop neck stiffness, and sometimes they can convulse, and there's also difficulty in swallowing. That is now the time it's attacking the spinal cord and the brain. Even there is numbness or paralysis. And when it reaches stage 2, my dear viewers, Akot, karibu karibu. Akot ameingia. Akot TV, it is morning huko. Okay, welcome again, and we welcome you. We welcome you. Let's welcome Akot so well. Oh, let's welcome you. Welcome to Family Vlogs. Now Brian amekuwelcome vizuri. Sorry. I got that message. I was spinning what Brian has said. Oh, I don't know. This thing. Yeah. I was pinning what Brian has said as is welcoming you. I don't know what I don't know what. It's a mistake that I've done, and I don't know how I can rectify it. Let me just see how I can rectify hiyo mambo ya code. I was spinning what Brian said, and unfortunately, okay, Asumbi TV has said something. Why do they bite like a dog? Mtu ameuma na dogi. That is muscle spasms, muscle spasm or spam. That's muscle spasm of the jaw. So when the furious types, or we were going to discuss about forms of rabies. Not necessarily they bug like a doggy. It's always a myth, but when there's muscle spasm of the jaw, we have the muscles here the Marset and the Bushneters. Now, the time they try to talk, that's backing. It's not necessary backing. Um, there is something that has happened in terms of uh, presentation. I don't know what has happened. I'm trying to post something and amepotea tu. I don't know nimebonyeza nini. I think she will be back. I don't know nimebonyeza nini. I think she'll be back and I'm very sorry for that. Somebody can just tell a court that sijui nini imekuwa mbaya. So guys, this asante bro, imagine niko invisible hata host hanioni. Pole sana court. I don't know what has happened. I don't know nimebonyeza nini and akota akapotea tu. I was trying to pin something Brayo said there and I'm trying to, I don't know whether she's back or not. Sorry, this touch screen, it's normally not good. Asumbi TV umesalamiwa hapo and let's continue with the topic. I don't know whether court is back. Hi, what has happened? I don't know. Network is also buffering. And I think we are going on well. The network is slightly buffering and I'm trying to recheck what is happening here. So kindly, guys, let me just try to rectify this problem. Yeah, wait, maybe. I'm back. The network is buffering and I don't know. I'm using 4G and I'm doing live stream in the evening in 10 Kenyan time. I will be happy to see you in. Okay. Thanks a lot, Monique. The network is occurring. Let me just post this one. Hi. Guys, I'm not happy with this. Panda juu ya kiti upande. Ayo. Network inasumbuana hapa. Let me try to rectify this thing. I don't want to lose this good discussion. Why is it sumbuana tu when I'm vlogging? Okay? Mbona haikusumbua jana, mbona haikusumbua juzi? But I'm trying to rectify this so that we can continue with Hey, hey, sorry guys, this thing in a letter bala. Sumbi TV. I hope I've rectified that. Yes. Am I good now? Sumbi TV, welcome, so that we can continue with the discussion. I've pinned you. I thought you were having live. Thought you were having live pinning. Hey. Sawa sawa. Let's continue. I invited you to. I don't know whether I'm still visible. Am I kitu inasumbuana?
Family. Hello.
Oh. Hello, I'm seeing you now.
Yeah,
Are you
I'm
seeing
very
me?
here. I
Dinas,
can see you. I can see you perfectly.
are you getting me, my dear friend? Or network is so bad?
Iko sawa sasa. You can just continue.
Hello? Are you getting me well?
Iko sawa.
Hello? This, no, this is very bad one. Oh. Good time. Network is buffering. Okay. Let me use PC. Just stay with me, rectifying the problem. I'm trying to rectify what? The network is, am I good now? Okay, so I hear you well. Still carrying on. Invite more people to join me. I don't know what happened to Akot TV. I've never used this StreamYard in streaming live. I've tried to look for her where she's hiding in this my 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 nini, but I can't see her. I've tried to look for her. Let me see Akot TV. Put user in timeout. Block it. No, I should not do that. Akot said asante bra, imagine niko invisible hata host hanioni. What? Invisible? What happened? Somebody to tell me before I continue with the discussion. How can I bring Akot back? Okay. Inje amesema umemweka timeout. Timeout. Oh, God. Timeout? How can I bring her back? Yawa, hii kitu sijui nimeweka nini hapa. Monique, unacheka mimi. This is the other lives I used to do here on settings. Okay, let me see. General. Okay, settings nimeangalia hapo. Let me see. Where is this thing? Okay. Now I'm trying to rectify what is the problem with mbona Akot amekuwa timed out. And can she be able to rejoin ama? Because ninajaribu kuweka hii kitu na sioni nini. Amesema angekuambia how to. Sasa kuna vile atakufikia if you can access WhatsApp. Okay. Let me see whether I can access WhatsApp. You guys continue being with me. Kitu ni stress. Next time, with PC is very easy, but now with phone, the camera. Oh, Queen, karibu. Okay, wacha niku. Queen amesema she's late, but better late than never. Ushafika. Karibu sana. Karibu sana Queen. And I'm trying to reach Akot TV so that I can bring her on board. I don't know nimebonyeza nini na kapotea few. Queen, karibu sana. Let me see whether I can bring Akot on board via WhatsApp. She says I should talk to her. Let me see whether I can bring her back. Trying to scan this WhatsApp, but it's also taking time because of network. So let's continue. Now, can you tell Akot to try re-entering? I've checked all my settings, nione penye yako ama penye nimeblock ama penye nimehold. I can't access WhatsApp now because it's the same phone I'm using in vlogging and the network pia inaleta shida. So for those who are here, we were talking about rabies, and now the vlog imeleta tatizo kiasi mpaka sasa hatuwezi endelea. Now stage 2, I talked about photophobia, fear of light. I talked about hydrophobia, fear of water, and then muscle spasm, neck stiffness, and drooling of saliva. Ukiona a dog normally drools saliva, but excess drooling of saliva is a sign of rabies. And also in this state is whereby a human being will develop paralysis, utakuwa paralyzed because of this. And also you can start hallucinating and developing fear of unknown. Sibia karibu amesema amekuambia, but how? Okay, I don't know how I can reach that. Okay, let me click solo layout. I cannot remove from stream. Thank you so much, guys, for being patient. I have 4 online, 3 online, I mean, and I'm very happy. The way this gadgets are working. You know, with PC, it can be very, very easier. But now with the phone, you know, phone is touch. Ukiguza tweak, something is gone. And I want to tell you that now I've rectified that, and I'm happy that 3 of you are two are with me. 2 are with me. Let's continue. Now we've said difficulty in swallowing, hydrophobia, that is fear of water. We've said drooling of saliva, say stiffness, and eventually it can lead to convulsions or seizures. When it reaches that level of convulsions or seizures, I can tell you hapo sasa hakuna kurudi nyuma. Death normally occurs within very few hours of convulsions and seizures. And I said earlier that when you have that furious type of rabies, death occurs very fast, rather than if you have paralytic. I said that we have two forms of rabies: furious rabies and paralytic. Now, I'm trying to rectify the error that occurred in terms of presentation. Queen Atieno umesalamiwa, amesalamia Monique. Karibu sana. Thanks for staying with me. I think you are the only one I have here. Yeah. Now, how do we diagnose this form of rabies, either furious or paralytic? Majorly, diagnosis is based on history and physical exam. History and physical exam. In that, history and physical exam, in that there must be a dog bite. And then how the patient present in terms of either furious or paralytic. If you see paralysis, know that that is a furious type, and that's a paralytic type of rabies. Now, it is not known. There are very less ways of diagnosis, laboratory tests being done, except dogs are euthanized. Karibu sana Monique. Dogs are euthanized. That one means that they are killed, so that to confirm whether they have rabies or not. There's a bright light in my head. Whether they have rabies or not, sorry, they are killed to confirm. And part of the brain, two parts of the brain must be taken to for examination, laboratory, to confirm whether they had rabies. And it must be two parts of brain of the dead dog taken to the lab for confirmation. And this one will also help whether treatment to continue or to stop, because buying anti-rabies sometimes is not very easier. Now, how can you know that your dog is having rabies? A rabid dog, how can you know? Just like those symptoms that I mentioned in human beings, they can also depict in dogs, and it is very serious. One, your dog sometimes can have fever, just like human being, and you will just know that this dog is not my usual dog. He will be calm or aggressive. He will be sleeping a lot, or he will be hallucinating, barking at something which is not known. And then salivation will be excess, that we call excess drooling of saliva. I was making this mouse, it's bringing a problem. Then if you give a dog water, it will also be having mwakazi. Thank you so much. You are in the building. Let me welcome you. We had technical problems. The mwakazi in the building, you are pinned. You are a very important guest. Thank you for coming here. I will be checking everyone who will visit, so you will see me on your comments. Very nice. Hello, Godfrey. Oh, that's Mwakazi. Karibu sana. Mwakazi is in the building. Mwakazi normally does mambo za kunyosha misuli and weight loss. Visit his channel, subscribe, and watch the videos, and also try. That is the only way we can accept. Try that exercise at home. Karibu sana. We have this. We time we're laughing. Network is very bad. but I'm very happy. Three have kept going with me until now. And we've mentioned, in terms of definition of rabies, we've mentioned signs and symptoms. We've mentioned types. We've known that we have two types uh, of, of rabies: furious rabies and paralytic, the one that makes you to be paralyzed. Okay, that's a greeting. Now we were talking about when to know whether your dog is having rabies. I've said your dog can have fever, excess drooling, that's saliva from the mouth, and also your dog can be hallucinating, barking at nothing at night or at daytime, or your dog can be calm, or excess aggressiveness of your dog. Your dog can start vomiting. So those are basic knowledge that you must have. If you see your dog is behaving like that, kindly please make sure that you take this your dog to a veterinary, because if your dog is having odd behaviors, he's chasing things, even when your dog starts to be when your dog becomes paralyzed and starts mutilating itself, anajikula, uh, is chewing itself, and also it's also chewing twigs, earth, is nakula kila kitu yenye imepata. That one is a sign of a rabid dog. Now let's go to management. Sasa hii ni ya madaktari, but there's a part that you can do at home. Like if you are bitten by a dog, it will depend on the extent of the bite, and also management and prognosis. Prognosis ni ile kuendelea kupona. Management and prognosis also depend on where the site of the bite. Just like in snake bites, also prognosis depend on the site and where. Now, wash with the running water. In fact, WHO recommends you wash the. Let me put this laptop like this. It's bringing a lot of light. WHO recommends that you wash the affected wound for at least 15 minutes with running water and soap. And also you can use detergent like iodine or povidone. That is the first thing you should do at home before you bring the patient to the hospital. So in the hospital, we do our part in terms of management, looking at the wound, whether the wound is so big that will require suturing, whether the wound needs only dressing. So you must do that at home. And again, your dogs, you should be taking for vaccination. There's vaccines for dogs, and also creation of awareness about what to do when you have a dog bite. Or I said causes can be through bite, scratch, an exposed wound, or any breakage in skin continuity with mucosal lining is exposed. This will warrant this person to go to the hospital, particularly if the dog is not receiving vaccine, and the dog is behaving uh, as if this is not my normal dog, the way I've mentioned earlier. It is not only a bite, even a scratch. We've talked about dogs so much, even cats. I've said earlier that cats normally do that. Yeah, we are talking about rabies. That's where I'm coming to. Okay, that is where I'm coming to. Let me just post that. Vaccination is very, very important in terms of prevention. That is immunization of. This is normally recommended. Now we are talking about the post of Mwakazi. It's where I've reached. So in prevention, we say you vaccinate dogs, you create awareness. And when dog bites you, you wash it for 15 minutes with water and povidone plus soap. Now, in vaccination, we have this is now our part that we normally do. If you come to the facility, what we normally do is check the wound, the way I've said. If it's big, we do dressing. If it needs suturing in English is called what? Sewing. Sewing ni yanguo. If you need to be stitched, that is the correct term, we stitch it, and we provide you with anti-tetanus, because you know, even snake and dogs, Clostridium tetani, they normally harbor them in their oral mucosa and sides of the teeth. So that's why we normally give anti-tetanus for that. And now it comes to vaccination, where we give post-exposure. Pre-exposure is also there, and this is normally recommended for those handling the live rabies. Those who are normally working in the laboratories, those who are working in the game parks, those who are handling animals, they are given vaccination. And those who are living in high risk areas where rabies are too rampant, they are also recommended to go for hospital for vaccination. In Nyanza as a whole, pre-exposure, that is PrEP, vaccination is very rare. But we have post-exposure. That one is when you have been bitten by a dog. And we don't just give anti-rabies like that. There are categories of consideration of how we give anti-rabies. Now, I will start with the last stage, where there is a bite, there is exposed skin, and there's a wound. That one we must give you vaccination. So we have two types. PrEP, start with the one we instill at that. It's very rare to get, but in our hospital it's not. Hata mimi yenyewe as a medic sijawahi kutana nayo. It's called rabies immunoglobulin. It's not there, but lingine post exposure is also there. We normally give this vaccine, and this is how we give them. We give at day 0, and you come to the hospital, we inject you at deltoid muscle upper at day 0, then at day 3, then at day 7, day 14, and then day 28. Now you've completed the dose. I repeat again. We give you a total of 5 doses. So when a dog bites you and you are thinking of, you are suspecting rabies, know that lazima ukue tayari kutumia pesa, because one dose is 5,000. No, one dose is 1,000. Even if you go to chemist now, you will buy a dose at 1,000. So 5 doses, 5,000. But we are happy there's one provided with the government. That's around 200 shillings. Yeah, 200 shillings, and maybe you pay 50 shillings for injection. So you will spend around 350. So it's a bit cheaper. So we will give you at day 0, meaning if a dog bites you today, today is day 0. Then you come back to the hospital after 3 days. Then you come back to the hospital after 7 days. Then you come back to the hospital after 28 days. Total of 5 injections. Not that you are going to be injected today, tomorrow, the other day, another day. No. So that's how we manage this. So let's take care of our dogs. Let us immunize them. Let's take them to the veterinary. And if a dog bites you, know what to do, as we have mentioned. Any questions before we move to B? We both move to snakes. Kenya Sihami was really waiting for snakes. Any question about rabies until we move to snakes? snakes, and then we go to mini. Uh, so I'm not seeing anyone asking any question. Snake bites are very fatal, and this one can kill even before you reach the hospital. There are very many species of snakes, even as medics or you there, you can't know. There are what, past even 100 types of snakes. Queen, unaogopa shindano. Itakubidi. Itakubidi. Did you hear all those symptoms? In fact, if you remember, if you reach the state that you have photophobia, you have paralysis, you are fearing even water, even sound, even egophobia, or I didn't mention fear of air. Uh, Breathing air, unaanza could develop spasm and convulsions. Now, snake bites is also neglected tropical disease as the one we've discussed. Rabies. Neglected tropical diseases are diseases that government do not take keen interest in, like they take keen interest in HIV, TB. HIV and TB is topping the list. But this one, like snake bite, rabies, in fact, if you go to the hospital hautapata hata hiyo vaccine, ama zinakuja na zinaisha within weeks because of consumption is very very high. So there are very many types of snakes, and each and every one present with different types of signs and symptoms. We tried to look for the one that are localized in Kenya. There's very many snakes. There are even some which are found in other countries. But one thing you remember that there are no snakes in Antarctica. Not that. Antarctica hakuna snake. Why is that there is no snake in Antarctica? That place is the most cold place, windy. It is only left for research. So, wow, hawana snakes. Now, snakes are very many. We have, I mentioned them, that we have black mamba, we have cobras, we have puff adder, and we have vipers. There are very many. So the one that we normally see around, even when I was young, the green one, the green snake. Do you know how it is called? It's called what? It's we have two types. There's a one which is very big and it's green, and there's one that unakutana nayo kila siku, and some people normally say it's not poisonous. It is poisonous, my friends. And let me see the name. In fact, the name nilikuwa nimesahau hapa. We have boomslang. Boomslang is called tree snake, and it is green, and it can swallow frogs, etc. And then we have another one. It is East African what? East African black mamba, and it is green. There's East African there's East African black mamba. Sorry, and there's also one which is green. I'm forgetting the name. I'll remember the name, and I will tell you how it is called. I didn't put it down here. I will remember its name now. Generally, snake can lead to paralysis, can lead to death. That is now eventual prognosis of snakes. Now, I want to assure you that if you are keen here and if you are bitten by a snake, mostly snakes do not bite, and some are calm, but they will only bite you when you step on them, or there are some that, like spitting cobra, will sense you when you are far away and start spitting that saliva, and that saliva is very dangerous. If spits into your eye, it can lead to blindness. Now, what happens if it bits you at that local plate, whether in that localized area, the feet, in any place that it bites, you will have tingling sensation and pain, and even you will feel your feet is very, very heavy. That is a sign of uh, a poisonous snake. And if there is no immediate action taken, then it can even lead to paralysis. It can lead to that tissue which has been affected to get necrosed in hours and die. And it become gangrenous and it dies. So that's why if you are bitten, if you have a snake bite, you should rush in the hospital as much as possible. First thing you should do is to apply a firm bandage. A firm bandage, watu wengine wanasema you tie the major arteries with a strong tourniquet. That is not recommended because snake bites are called myotoxic. Myo means muscle. They are toxic to the muscles, and if you tie at that localized area, they will start attacking the muscles and the muscles will die. So you just apply firm bandage, maybe to control ble to uh, control bleeding. Now, remember, they are also neurotoxic. They are also neurotoxic, meaning they interfere with your central nervous system. You know, the brain controls the way we breathe. It controls coordination, things like that, by our central nervous system. Now, if at all uh, you are bitten by a snake which is neurotoxic, for example, a black mamba, you will develop signs and symptoms depicting where the brain center controls. You will have difficulty in breathing, you will have convulsions, and eventually shut down and you will die. You will even have slurred speech. You will not be able to articulate words well. Let me just check something. Yes. So in black mamba, we say that you will have tingling sensation that's at the part where the snake has bitten. And again, it will also, the feet will feel heavy, like I've said, you're not able to walk well. And now your body will start responding. Pain, headache, and eventually fever. And like black mamba, we say that it will kill you within 10 minutes. So it's one of the most dangerous and poisonous snake because within 10 minutes hautakuwa unafika hospitali. Now, there's something. Those people eat cobras, even vipers. They eat mpaka python. Asumbi TV has have asked us a very nice one. How can I put it? Let me not dial and upote. Okay. Which types are those that are eaten by Chinese? Chinese normally they know how to extract poison from the fangs of the snakes, and they know how to make it until they don't die. So cobra is very poisonous, but they eat. Vipers are very poisonous and they eat. Even the green one that is it's found in the street, they eat. So they almost eat any, but they normally like the big one, the pythons and the cobras. Now, signs and symptoms of being bitten by a snake almost correlate. They are almost the same. I've talked of myotoxic, neurotoxic. When they are attacking the central nervous system, again, I did not mention about, oh, I mentioned about coordination. You can't walk well. Now, what you normally do is just to wash the part of where there's the clean water, apply a bandage, a firm bandage, do not use tourniquet, and then rush to the hospital. It is just because of their poisonous snakes, like the one I've said, the black mamba, which can kill you within 10 minutes. But this one depends on several factors. Uh, Cobra can take up to 30 minutes. So it means you can still reach the hospital. And this one, it is not a rule of thumb, a rule of thumb that if a snake bites you, it is documented that you can die within 30 minutes. This one will depend on how aggressive the snake was provoked and the dose of the venom that it has inflicted in you when you are being bitten, and the site. When it is in the lower limb, sometimes you can reach the hospital, you can be managed, but it's a bite on the neck, uh, on the face, that one is closer to the brain. You can die very fast. So, in the hospital, we give antivenom. There are generalized antivenom, and there are some specific for specific um, snakes. And this is where we have a problem because if the patient is in the hospital, you give this, does not respond. So when surgeon comes, you want a specific because you tried this is not working. You want a specific one for black mamba, you have a specific one for bypass, and it is really not easy to get. So sometimes it's just trial and error, but there are developments going on. There are vaccines that are available. There antivenom, sorry, that are available that we normally use, and patients normally get better. The only problem that normally occurs is that when somebody arrives late, he has gone to traditional attendants, traditional people, I don't know how they are called, herbalist, yes. Um, they have insights that place, they have introduced some herbals, they have brought so many infections in that particular place. So if they come to the hospital, in fact, if I could have been presenting this, I could have shown you a very gangrenous fit that was not treated and imeoza kabisa. So you will get that from the thighs going onwards to the knee to the leg is black. That means imeform gangrene. There's no blood supply, the nervous supply is dead. This person even cannot feel pain, but the goo is rotten. So snake bites, we take them very, very serious if they come to the hospital. And WHO normally say that you treat snake bites even if it comes after some times as a new case, because some normally persist in the bloodstream and cause problems later. Now, I've vlogged for 1 hour 19 minutes. Let's continue with the beasting. Kenya Sihami, you said something. Usharushwa nje host. Oh, yeah. Nini, I've really tried to bring a court back, but sijui nini metendeka. She wanted to tell me of how I can bring her back, na imekata kabisa. So maybe in the next year I will call her personally and apologize. She told me how to use this StreamYard yesterday, but sasa yeye ndio sasa she's locked out. Beastings are very serious. and can cause death if not taken care of. There are some people who can be stung by a bee and they don't develop any hypersensitivity reaction. And there are some individuals, those who are having allergies, if they're stung with a bee, they can die in minutes or hours. In that, there is hypersensitivity reaction happening everywhere. For example, in the trachea, in the bronchus, they normally clog and the airway, and you die of respiratory failure. Now, when a bee has stung you, there's removing the earlier the better. Removing it earlier the better. That is recommended now by WHO. They used to say usitoe mpaka ufike hospitali. No, you don't scratch it. You just scrap it. You don't scrap it like this. Just this worker bee. Queen bee. Oh, the queen bee machine. They normally don't sting, but they sting those bees that work for them when they are, it is said that when the hand smells of other queens, they can sting. Honeybee, the one that makes honey, can sting you to death. Now, management is if a bee, okay, if a bee stung you, you can just rush and buy some steroids, prednisolone, piriton. But if it is too much of them, then this one needs hospitalization. You must be given some steroids via injections, and then we manage you as you present. And it is very worse to those who are suffering from uh, allergies like asthma or those who have skin allergies. They normally react so bad to toxins of bees and they can die within minutes. And also in terms of bites, you can also have wasps and hornets. They can also cause this, and also can also be treated with steroids, and then you pain. Human bites can pose a great risk because they can bring hepatitis B or C, herpes simplex. They can even bring, can contact HIV and TB. Management is case by case, the way it is presenting. You cannot manage HIV if somebody is HIV negative, but of course we will give post-exposure prophylactic and in antiretrovirals, and then we do the necessary test uh, depending on yes. Oh, ooh, hi, accords. Hey, hey, hey. So, my dear, let me bring you to the screen. Just, I'm very sorry. I don't know nilibonyeza nini. And you'll be, I'm just a form one in this. I'm just a form one in this stream here. Will you comment? I wanted to pin. In fact, I wanted to pin like this, like that, the way I've done. And sijui nilibonyeza nini na ukapotea fume, and I didn't know what to do. People have complained. I said I will apologize to you. I'm very sorry. I'm very sorry. I know next time it won't happen. But we have done it for 1 hour 24 minutes, and we are still kicking. And now I'm with you. We are two now online. Thank you so much for coming back. And that what happened is will not repeat itself. So I want just to recap for the sake of you, starting from the leg. we talked about rabies. Just I want to recap the most important thing. Rabies caused by bites from dogs, and it's a zoonotic disease that is from animal to human beings, and it normally brings inflammation. In fact, it's called encephalitis, inflammation of the brain, because it's a viral infection. And again, we said it's normally occurs in children, 15, 5 years to 15. And this is a viral infection that can be prevented by immunization. Um, and again, then, yes, it can be, it's okay. I know it was a mistake. Ulibonyeza kidude. Yes. And again, prevention is key in terms of rabies. We must immunize our dogs and also create awareness, health education on dog handlers. And also, we must come to the hospital for proper checkup. Then we talk of snakes, and snakes are very many: black mambas, the vipers, cobras, puff adders. We found that they cause stress in terms of their presentation. They can kill you within 10 minutes. Some can kill you within hours. The hallmark of it is that you should come to the hospital and you avoid tourniquet. Tourniquet is tying the major arteries and veins with a very yes. We talked of if you come to the hospital, we'll give you 5 doses of anti-rabies and tetanus, and plus any other management the way you present. The doses that you will be given at tutakudunga hapa kwa deltoid muscles for 5 days, for five times. I mean, sorry, from day zero. That is, if a dog bites you today, you will be given that drug day zero, and day 3, day 7, day 14, and day 28, na utakuwa umemaliza. And then also you can observe the dog for 10 days and report back to the hospital. If the dog is lost, that one we can give you. We can just, uh, if the dog is well vaccinated, can it still spread it? The dog can be vaccinated today. Tomorrow it gets a bit. It depends on the dose of the other rabid dog that is attacking it. It is not a rule of thumb that if a dog is vaccinated, then it can't spread um, rabies. It is recommended even if a dog is vaccinated and it has bitten you, then there is a rule that we normally follow. One, we observe the dog for 10 days, because a rabid dog will not pass 10 days before it dies. That is the hallmark of it. Within less than 7 days itakuwa imekufa, if at all it was having rabies. So that's why the WHO and public health needs you to observe the dog for 10 days. If the dog is lost, dog vaccinated, dog is lost, we have no choice, we'll vaccinate you. If a dog is euthanized, meaning the dog has been killed in one way or the other, we will there is no we will take this dog to the laboratory. We remove 2 tissues from different parts of the brain. We check whether there is rabies, presence of virus or causing rabies. If it is not there, then we start treatment. If the laboratory result comes that there is no rabies, we stop treatment. So it is not a rule of thumb that if a dog is vaccinated, then it can't spread uh, uh, rabies. We also talked about bee stings and no, bee stings, snake bites, and we talked that snake bites can cause toxicity to the brain that can bring paralysis, difficulty in breathing and coordination, or central nervous presentation. Yeah. report back to the PHO. The network is buffering. Now, and also with snakes can kill you within minutes and hours. So it's better to rush to the hospital really quick because they cause paralysis. They also cause incoordination, ataxia. You walk like staggering. They also cause what we call dysarthria. You have difficulty in articulating words. They also cause fever, tiredness, and even blood vision. If a snake spits into your face, you might develop blindness. So, and then we've talked about bee sting, wasps, and hornets. They cause hypersensitivity reaction, and it's more common to those who are having allergies. So the way those who are having allergies are managed differently with those who don't have allergies. Some people can present with severe hypersensitivity reaction, rashes all over the body, difficulty in breathing, blood pressure dropping. You see, so those ones we normally manage, and they require admissions. But if a wasp sting you, or even hornet is otodo in our mother tongue, dulu otodo. Yeah. So and human bites. Human bites, we normally say if a human bites you, we have things that we must suspect: hepatitis B, HIV, TB, tetanus. These ones we manage case by case. Thank you so much, Akot, for what someone has been bitten by a snake and the hospital is out of reach. Any first aid measures that one can take? Yes, there is. Of course, I've said that you tie up, you wash that place with the running water and tie a firm bandage at that particular, depending on the place, you tie a firm bandage. And then you look at the way you can take this. It depends with now the types of snake. There are some which can kill you within minutes. There are some that can take time. It's not a rule of thumb that black mamba will kill you within 30 minutes or viper will kill you within an hour. So ati otodo unasikia for the fact Queen Atieno Otudu is hornet. Okay. How can I say? If you go to your old house, or if you go to any house, even the ones we were staying here, and you check the timbers, the timber, you will find one insect that normally bores that timber and enter, and it has a noise like todo, 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 todo. So this todo is what Lewis call it, or todo. So children like playing with that hornet, and if hornet is provoked, it will give you a proper sting. Remember, hornet is a very calm creature. It's a very calm insect. It doesn't even sting. It doesn't if it's not provoked. But if a child goes with a stick and start. Yes, yes. Thank you, Akot. I'm also ending this. And if it goes and attacks and starts interfering with where that hornet is staying, surely will bite you. It will sting you. So, but wasp nai, just passing along where they are staying, we call it pino, and the yellow one is very thorough. If passing along where the wasp is staying is tantamount to a sting, and the sting is some. If you ever been, if you have ever experienced the sting of wasp, then you know it. 2 to 3 minutes severe headache and pain with numbing sensation, and they normally sting the head. Okay, now thank you so much, my guys, and I hope I wanted to say something. Tomorrow, I will be going live again, but not the scheduled one. This is the strike that we are having, and we are going for for strike demonstration. You know, serikali ya Kenya, we are in a major strike, and we are still at home. Major demonstration in Homa Bay County. So it's allowed by the law to picket. So I will provide that live coverage so that you people can enjoy. Otherwise, thank you so much, and God bless you all as I end this. In Jesus' name, we pray and believe. Amen. 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 Let's end it. Mzee.